This morning, we're following the first Ebola case in New York City. Craig Spencer is the fourth American doctor to be treated in the United States after being infected in West Africa. Dr. Jon LaPook sat down with another member of that very small group. It is an interview you will see only on CBS This Morning. John, good morning again.
Good morning again. Only a handful of people in this country know firsthand what Dr. Craig Spencer is going through right now, and one of them is Dr. Richard Sacra, a missionary who was infected in Liberia. I met him at Mount Sinai Hospital, one of 8 centers designated in New York for the treatment of Ebola cases.
Rick Sacra.
Very nice to meet you.
Although Dr. Rick Sacra is free of the Ebola virus, he still feels its stigma out in public.
What do you think's going through their heads?
There's that, I don't know, that's that Ebola guy.
After a brief bout with a respiratory infection earlier this month, Dr. Sacra is now on the mend.
When I got my medical records a week ago and really started looking through them, I was like, wow, I was right on the edge. I'm just now beginning to feel like I can start exercising, start building up my stamina.
Can you figure out how you got Ebola?
I was working at a hospital, ELWA hospital. I was not working in the Ebola unit. Some of the pregnant women we took care of were very sick. None of them had all the signs and symptoms of Ebola, but some of them had been in labor for a week.
You're treating a pregnant woman,
Right.
And you didn't suspect that she had Ebola?
This particular one, who I think is the most likely, was actually HIV positive and didn't know it. But I now suspect that she also had come down with Ebola and didn't know that either.
On September 5th, Dr. Sacra arrived at the Nebraska Medical Center for treatment. For 3 weeks, he was kept in an isolation room.
How were you able to interact with your wife?
Because of the way their unit is built, she could never come in and look at me through the glass. We could never have a direct line of sight. It was always just on the computer.
What was the first thing you said to her?
Well, it's funny because she said, "How are you?" to me, and I said, and this, I don't actually recall saying this, but the nurses reported and confirmed this, that I said to her, "Well, honey, this is not my favorite case of Ebola."
Your own.
Right.
Tell me about that first time when you walked out of the unit and you were able to actually give your wife a hug.
Oh, my wife is there, my kids are there. It was just wonderful just to have a hug. I don't know how long we hugged for, 5 minutes.
Has there ever been a hug in the history of hugs like that?
No.
Dr. Sacra says he wants to go back to Liberia, which he calls his second home.
In Liberia alone, we've lost almost 100 healthcare workers. It's going to take time to rebuild that health system.
You've lost good friends during this battle. It almost is like war.
Yes.
And you survived.
I did.
When do you think you'll go back?
I'm praying about early next year, if the Lord will give me my strength back.
And you'll be immune to this strain of Ebola.
I will.
You'll be able to touch somebody who may have Ebola. You'll be able to put your hand on somebody else's hand.
Survivors are now working in some of the units as counselors and helpers. Some of them are coming in and providing that human touch.
Dr. Sacra also has a message for Dr. Craig Spencer, that his odds of survival are pretty good, and he should stay positive and optimistic because many people all over the country will be praying for his recovery.
John, thanks.